We interrupt programming to bring you this News 18 special report. News from where you live.
Good afternoon, I'm Meredith Hackler. We interrupt your regularly scheduled programming for Governor Eric Holcomb's weekly press briefing. It was pushed back today due to the inauguration as well as enhanced security protocol at the Capitol. It does look like he's getting ready to speak. Let's listen to what he has to say.
Wednesday on Thursday, but the days all blur together, so it's 2:30 someday during the week. But we're very glad that you have joined us again. We'll spend the bulk of our time today in our portion of it talking about the vaccination plan and protocol and how it's playing out across the whole state of Indiana. It's heartening to see many Hoosiers who are eligible to step up and get a shot in the arm are doing exactly that. It's a good problem to have. We said last week our real main limiting factor is the allotment or the allocation that we have from the federal government. So we say a lot around here, we need more because we have the infrastructure and the logistical plan put in place to be able to get it out to all 92 counties. And I'm sure you and Dr. Weaver will go over this, but the latest numbers that I looked at in the 70 to 79 age group, we have scheduled or have vaccinated about 238,000 Hoosiers, which that group totaled 470,000, I guess, so we're over 50%. So when we were talking about 20 or 30% saturation rate, where are we going to be? This is a good thing to have those folks either vaccinated or scheduled. In the 80 and older group, about 125,000, north of 125,000 Hoosiers who are scheduled or have been vaccinated. And then, as you have described them to me, the vectors in society and most importantly the healthcare workers, those folks on the front lines, 264,000. So, the goal is, or the ultimate eligible was 5.4 million, and we're at 626,000 scheduled or already vaccinated. Plus, by the way, the long-term care facility residents that aren't included in that equation ultimately for that total number. But you all will, both you and Dr. Weaver, will go over that, I'm sure, in your portion. But it really is encouraging to see that and to see how we've been able to evolve and ramp up over time, over the days and weeks since we've been doing this. Started with 5 sites, quickly went to 55, I get it, but started, that first day or a couple of days at 5 sites, and to think that we're at now 189 different sites throughout the state of Indiana. I looked at one state I was told had 9 sites. In a state, our size or larger, and so there's different approaches out there for sure, but I'm really pleased that our very methodical kind of maybe under promise, over deliver approach, making sure that we're not over promising, that the expectations are aligned with actually the results that are occurring. This approach is making not just sense, but it's effective. And so thank you for the job that you all are doing. We're seeing this, and too early to tell probably, maybe you'll get this question, maybe you'll get it 3 or 4 times. But the question is, ultimately, as we've said, the faster immunization, the slower the spread, or will bring down deaths and will bring down hospitalization rates. And again, maybe too early to tell, but those are coming down. I mean, it's just the facts are the facts, and we're starting to see reason for optimism as we look across the state of Indiana, and you see that positivity rate tick down, tick down, tick down, and we were just felt like yesterday we were in the 16+% range. Yeah, and now heading in the right direction. There's probably some reasons for that, but we'll take all those things under consideration. We're working on those right now in terms of what that will do. I'll extend the executive order for just another week as we digest these numbers. We don't want to get ahead of ourselves. We still have most counties in red. And so while I may be giddy right now, just looking at, trends and trajectories, we're still over double digits positivity rate, and we're still losing people. And so we want to make sure that we do this in a very responsible, data-driven way, as we've done from the very beginning. But the executive order will be extended for a week, and then we'll look at what that would do in terms of how we are managing this locally as well, events, capacity numbers, et cetera. But heading on the right path. And with that,
Most definitely.
more good news.
All right. Thank you, Governor. Good afternoon, Hoosiers. In just over a month's time, more than 362,000 Hoosiers have received their first dose of vaccine. And of those, nearly 88,000 have received both doses and are therefore fully vaccinated. That is an incredible milestone for our state and represents the first crucial steps on a journey back to normalcy. But as with any journey of 1,000 miles, you take one step at a time, which is why we continue to follow our age-based approach to vaccine eligibility. This data-driven approach focuses fully on our goals of preventing hospitalizations and saving lives. With high demand comes the need to level set expectations. As Dr. Weaver will explain in more detail, we are limited in how quickly we can expand vaccine eligibility by the amount of vaccine available at the federal level. We have partners across the state who are eager to join the vaccination effort and expand their clinics. Many of our local health departments continue to clamor for more doses because of the interest in their communities. Rest assured that we will continue to request every single dose that the United States federal government allows for us to access, and we will get those doses out as quickly as possible. The doses that the federal government approves for us to go directly to vaccine sites, we will get them there. We are getting vaccines in arms as quickly as possible. We are being asked about opening mass vaccination clinics. As of now, we are receiving limited vaccine, and the appointments are being made as fast as we receive vaccine and open the slots. Our focus remains on expanding the number of clinics, removing obstacles to vaccines for those who are eligible, educating and answering questions about vaccine safety and efficacy, and creating a smooth process for Hoosiers to be vaccinated. I get regularly asked to provide a timeline for when additional groups will be eligible for vaccine. Right now, we are unable to predict when that will happen. We find out on a Tuesday what our allocation for that week is, and we work based on those numbers. For now, we continue to get about 78,000 to 80,000 doses weekly. I did want to share with you what to expect next. When we are ready, the next eligible group of Hoosiers will be people ages 65 to 70. This represents about 350,000 people. We don't have an estimated date for when this eligibility will open, and you cannot make appointments at this time in that age group. When we first announced our age-based approach, we had said the next eligible group would be Hoosiers, 60 to 69. So this is a small change in that we are breaking that category down, and we'll start with a smaller group of Hoosiers again because of the amount of vaccine that we're receiving. Keep in mind that the 65 to 69-year-old age group is about the same number of people who became eligible when we expanded eligibility to the 70 to 79-year-old age group. So when we are ready to add this age group, we expect an influx, again, of interested Hoosiers. The reason we will next add this age group when the time is right remains consistent. We want to protect our most vulnerable Hoosiers, and age has been the biggest contributor to hospitalizations and deaths from COVID. We are focused on saving lives and reducing hospitalizations. We started with Hoosiers ages 80 and older who account for less than 4% of the state population, but nearly 20% of the COVID hospitalizations and 52% of the deaths. Once we progress to make Hoosiers 60 and older eligible, we will have targeted the population that accounts for 93% of our COVID deaths and 64% of our hospitalizations. As we wait for more vaccine, I want to point out some very encouraging news. Our positivity rate has been coming down, as the governor mentioned, and currently stands at 10.8%. This is the lowest that we have seen in several weeks. We also have seen a decline in the number of Hoosiers hospitalized with COVID symptoms. As of yesterday, just over 2,300 Hoosiers were in the hospital due to COVID. That's down from nearly 3,500 on November the 30th. Daily hospital admissions have also dropped. On January 14th, 322 Hoosiers were admitted for COVID symptoms, and that's down from 504 on November the 30th. As we look at our color-coded county maps, we are seeing some positive signs there also. All 4 maps are improving from last week to this week. Our advisory level map, our 2-metric score, our cases per 100,000, and our positivity rate. The 2-metric score improvement is being driven by decreasing positivity rates. This week, 34 of our 92 counties are in red on the 2-score map, down from 73 last week. We also have 1 county in yellow this week. The rest are all in orange. This is encouraging to see, but I want to again caution Hoosiers that we still have a long way to go. Our advisory map, which indicates which level of restriction counties must follow, shows 17 counties in orange. That's a slight improvement from the 15 we saw in orange last week, but it still reflects very high levels of transmission across the state and leaves 75 counties in red following the most stringent guidelines. We hope these downward trends continue, but I want to caution Hoosiers not to let your guard down as this virus continues to shift. We have now seen at least 4 cases of the United Kingdom B117 strain in Indiana. In total, more than 122 cases have been identified in at least 20 states. As a reminder, this strain is a mutation of the virus, and it is more easily transmitted than the strain we were dealing with up until now. There also are reports of other mutations, including one that has been detected in South Africa. This new strain behaves much like the UK variant and also is more transmissible. It has not been detected yet in North America, but we continue to monitor closely for this mutation. We are very aware of some deaths that have occurred in Norway associated with the COVID-19 vaccination. These deaths occurred in their very, very frail populations. We are watching closely for any indication that they believe that the vaccine was causative of these deaths. Indiana has had 3 individuals who have passed away sometime after receiving their vaccine. Each case involved a patient with significant underlying conditions that were actively affecting their health at the time they received the vaccine. We have investigated each of these cases and have reported them to the CDC's Vaccine Adverse Effects Registry. I know that the Advisory Committee for Immunization Practices Safety Committee will also be reviewing all of this information. I want to remind Hoosiers that we have given more than 360,000 vaccines with very few severe or adverse outcomes. That speaks volume to the safety of these vaccines. At this time, there is no way to know if the vaccine played a role in these 3 deaths because these individuals already had health conditions that would have impacted their life expectancy significantly. These losses are tragic, and my heart goes out to the families of these Hoosiers. Sadly, we are closing in on a heartbreaking milestone in Indiana. Today, we reported 64 new deaths. That brings our total losses due to this pandemic to nearly 9,600 Hoosiers when you include the probable deaths that have been reported based on their clinical diagnosis. That's an increase of about 500 people since last week. As we focus on the promise that the vaccine brings, we cannot lose sight of the toll that this pandemic has taken on the lives that have been lost or on the tools that we have available to us today to help prevent further losses. Now, I'll let Dr. Weaver provide some more details about our vaccination efforts.
Thank you, Dr. Box. The vaccine progress we've made is incredibly exciting. We know Hoosiers are eager and anxious for their turn to be vaccinated. Our team is working to add appointments to schedules as quickly as our supplies allow. Last weekend, the team added more than 55,000 appointments between Friday and Monday. But demand is high, and those appointments go quickly. Nearly all of our appointments are booked for the next couple of weeks for those who are eligible, but continue to check back as we add more appointments. Go to ourshot.in.gov or call 211 if you need assistance. About 50% of Hoosiers age 70 and older have scheduled an appointment to get their vaccine. That is an incredible rate of uptake and shows just how much this vaccine means to our seniors. We are committed to providing a vaccine to any eligible Hoosier who wants one. At the same time, we need to ensure that we have second doses available 3 to 4 weeks after the first dose is administered. Despite being told that additional vaccine would be coming to states, we've since learned that there is no national stockpile. Our vaccine allocations have not increased beyond the roughly 78 to 80,000 doses we were already expecting each week. The system we have in place is to ensure that we don't have to do what other states have done, cancel vaccine appointments due to no doses available. So while you may be frustrated at the availability of appointments, you can rest assured that our goal is to ensure that there will be a dose for you when you arrive. We have received to date about 736,000 doses. This accounts for both first and second doses. This does not include an allocation of 112,000 doses set aside for the long-term care facilities. We have administered approximately 450,000 first and second doses to healthcare workers, first responders, and eligible Hoosiers as of this morning. As of today, we have about 286,000 doses in Indiana. We have more than 270,000 appointments currently scheduled for first and second doses between now and the end of January, and we are adding appointments into February by the minute. Essentially, we are running very close to one-to-one in terms of doses and appointments, which is why we cannot expand further at this time. We are aware of the over 2 million Hoosiers who, as a requirement of their job, must interact with the public and potentially be exposed every day. At this time, we must continue to concentrate on vaccinating those people who are at the highest risk of hospitalizations and death. Even people with very minimal risk of exposure still have a much higher risk of hospitalization and death compared to younger people who have a very high risk of exposure. I assure you we will expand eligibility as quickly as we can when we receive more vaccine. We have worked to set up at least one vaccine clinic in every county and to ensure that counties with vulnerable populations have multiple places that can offer vaccine, to make this as convenient for Hoosiers as possible, regardless of where you live. For instance, Allen County has 5 vaccine sites, Lake County has 14, and Marion has 12. We continue to work to expand access to vaccine through partnerships with pharmacies and federally qualified health centers, and we continue to look at options for large-scale vaccination options and mobile vaccination clinics for that day in the future when supplies do increase. We are also working to make sure that no one is forgotten, and we are piloting programs to get vaccinations into eligible Hoosiers who are homebound, and making sure in the meantime that no doses are wasted. We must continue to build confidence in the vaccine. We know there is significant vaccine hesitancy in some of our communities of color, and we are working with stakeholders around the state to share appropriate education and messaging to build awareness and trust in the vaccine. We also continue to work to make information available in other languages at ourshot.in.gov, and you will start to see Hoosiers from all backgrounds and regions of the state sharing their reasons for getting a vaccine as part of our public awareness campaign. When we say this is our shot, Hoosiers, we mean it's a shot for all of us. So please, learn about the vaccine and be ready when your turn comes. Thank you.
Thank you, Dr. Weaver. And with you, physically distanced, of course, is also Superintendent Doug Carter and Chris Johnston for the Q&A portion as well. But I also wanted to say just a few things, Dr. Box, that you reminded me of. One, and Dr. Weaver reminded me of, is we've gone from, in a period of about a week, from doing, Dr. Weaver, you told me 20,000 vaccinations a day to now 28,000 a day. And again, we need more. We'll get more out, but we have been able to scale this thing up according to the inventory or supply that we have. We're going to continue to look at this map over the next week and beyond every single day to make our future decisions, but we're seeing positive trends occur, not just positivity rate, but the R0 number has now come down. We're top 3 in the nation. Don't want to get giddy about that either, because we were one of the tops, and then this thing moves quickly. And our practicing good health or good public health, and private practices is key to slowing the spread as well. So the vigilance part, not just the vaccine part, critically important to what this map looks like as well. And I don't think it's of coincidence that also you were talking about vaccinations and the numbers thereof and its effect on our rates. We're also, Indiana now ranks in the top 3 in the nation for the Lilly, hometown hero, the Lilly antibody being used at our hospitals. In fact, one out at NDI you were talking about is the #1 site in the world for those therapeutics being used. So that also, one has to think, I don't have doctor in front of my name, but one has to think that that's having a positive effect on our hospitalization rates as well. You care to talk about that just for a second before we go to the Q&A?
So I think the monoclonal antibodies are so important, and the usage of them, just like other therapeutics. And really, we have had multiple people ask us for this. As soon as we get our doses that are allocated to the state of Indiana, we know from across the state what every hospital system would like to have, and we have to then allocate those out. And sometimes we can't even give enough for the certain sites. Some sites would like to have more, but we are making sure that sites are using those up and that they're efficiently and effectively getting into the arms of Hoosiers that need them, that are at risk.
Yeah. Greed is not a sin in this sense. I'm greedy, and I'm proud of it. You want to go right to the Q&A?
Matt from RTV6.
All right,
Matt,
well, some positive information from the governor's presser. Our positivity rate is down, as well as our hospitalization rate here in the state of Indiana. Also, some updates on the vaccine front. Be sure to stay tuned to News 18 at 5, 6, 10, and 11, where we will break down all of this information for you guys. But for now, we're going to send it back to your regularly scheduled programming.
This has been a News 18 special report. News from where you live.
Going very, very well. We know the system works. Hundreds of deaths and births have been processed through that. But we have had an issue with some of the deaths that finished and were completed right at the end of 2020, and being able to get those certificates finalized through our providers, many of which have not yet signed up for this new system, and get those to the loved ones. And I know that is a very frustrating issue for families. I know we have heard their concerns over not being able to do certain things with the estate because they don't have a death certificate, or birth certificates where people want those as they're filing their taxes. So we are in the process right now of developing in the next day a process by which we will be able to work with our local health departments and our funeral directors across the state and be able to get those out in a more timely fashion. I will say that we only have less than a third of our providers that were signed up in our old system now signed up in the new system, despite months and months of trying to get individuals to sign up through working through the hospitals and through the State Medical Association. So we are going to do a full court press again with our partners at the Hospital Association to see if we can't do that, because that definitely is a delay. And so we're working to address all of that, and feel like in the next week or two we'll have those kinks worked out, but certainly realize this is an inconvenience for Hoosiers, and we're really trying to address it and improve that.
Abigail with the Brown County Democrat newspaper.
Afternoon, Abigail.
Good afternoon, Governor, Dr. Box. I have two questions, actually. The first one is, how are you deciding how many vaccines are distributed to each county? And is there a data portal where we can see how much our county will get or has received or anything like that?
I think I'll let Dr. Weaver take that one if she doesn't mind.
Yeah, so great question. So when we started with our 55 hospitals, a lot of it was based on population, and each hospital who was vaccinating was actually assigned other counties around them to be responsible for vaccinations, and so that was based on population. We took that same model when we started to expand and looking to send it to our local health departments, again, looking at population, but of course assuring that they had the ability to whatever vaccine we were sending them, that they had ability to put get shots in arms. So those numbers really change on a daily basis as we very closely monitor what the uptake in different communities are, how far out they're booked with appointments, and then we work directly with the local health department to see, if we can find some more somewhere else and we were able to get it to you, would you be able to put it in arms, and then adjusting what our allocations are on a weekly basis if needed to be, or moving around vaccines. So it's not a stagnant number, but did start based on populations.
Dr. Weaver and Dr. Box, you want to comment on the latest that you've heard about potential, and I know you don't have a crystal ball here, but potential vaccines, additional vaccines that might come online? Are we weeks, months, or what's the status there?
So our head of our incident command and I were on a call with General Perna the other day. He said for the next couple weeks, we should just plan on the amount of vaccine that we have been getting, that we would not see a change in that. But he did hint at the fact that we could be in early February receiving more vaccine. I hesitate to even say that because I've become a bird in the hand woman. If I don't have it in my hand, I don't believe it. So Dr. Weaver and I will be very anxious to get more, and I can assure you we have lots of places for that vaccine to go so we can get it in Hoosiers' arms.
Nikki Kelly with the Fort Wayne Journal-Gazette.
Afternoon, Nikki.
Hello. I have been getting inundated with concerns from people who haven't been paid unemployment since December. Under the new program, hundreds of thousands of Hoosiers are having trouble paying for their medication and food. So what is taking so long to get these checks out to people?
Well, we have to verify each and every one of them. And we want to make sure that we're not participating in any fraudulent activity. And it takes time to go the extra distance when a lot of newly eligible citizens have been applying, and they should. And if they qualify and are eligible, they will be in receipt of a check.
Steve.
I think she had another. I think she had two, or maybe not.
Actually, I didn't, but I did want to say these were people who were already getting checks under the previous program. And when the new one was announced for the $300 in December, they are not getting them now.
I'll have Fred Payne look into it.
Steve with KPC Media.
Afternoon, Steve.
Good afternoon. How are you doing today?
Doing good, thank you.
A question. We've been hearing, one of my reporters was talking with a member of our local health board after their meeting, and we had heard that among one of our nursing homes and even at one of our local hospital facilities that only about a third of eligible healthcare workers or eligible staff members, let me say, have taken the vaccine. It's not so much the medical staff that is refusing it, but other support staff at those facilities. I'm wondering if that rate is atypical, or does that match up some things that you're hearing? And are there concerns that if, housekeepers and other staff members, maybe who don't directly have contact with patients, aren't taking this vaccine, are we, not necessarily going to make great progress in pushing the virus out of some of these really vulnerable places?
It's a great question, Steve, and I want to back up just a little bit and give you an update on where we are. We have our federal partners with Walgreens and CVS have actually been able to vaccinate 358 of our 535 facilities that are long-term care or what we call skilled nursing facilities. So that's 2/3 of our individuals' facilities have already received their first doses. That's about 20,100 residents that have been vaccinated and about 7,857 staff that have been vaccinated. It's a little hard to get a handle on exactly the percentage of staff that have been vaccinated through this program because we did open this up very early to the staff at the long-term care facilities to come to our other sites, which would have included our hospitals and now our local health department and federally qualified health clinics and community health clinics. So it's hard to actually rectify what that number is. I will say that when we did an early survey before the vaccine was even out and we were able to go around and start putting it in individuals' arms, that we only had about 45% of the staff that said they would take this. So I do believe there is vaccine hesitancy there, and we believe that as we go back to put second doses in arms in these facilities, that we will see an increased uptake among the staff because they will have at that time been able to watch their friends and fellow colleagues and how they've done with the vaccine.
Sherry with the Indianapolis Star.
Afternoon, Sherry.
Good afternoon, Governor. Good afternoon, Dr. Box. I have two questions, kind of one looking to the past, one looking a little bit to the future. When you look at the past, say the past month, one of the things that has changed in terms of the virus spread is that many of our counties were under stricter restrictions because of how high the spread had been before. So is it possible to tease out, especially seeing that spread is increasing in other areas of the country, is it possible that those restrictions have actually worked as opposed to some of the vaccinations that haven't been, that haven't had time to fully flower, even people who have had both doses, their immune systems are just sort of ramping up now. And my second question on vaccines is I'm hearing from a lot of seniors who are saying, I couldn't get an appointment until March or April. And they're very anxious about like having to wait more time for their first appointments. Do you have any programs, any way to help those people get appointments earlier, or do they just keep trying?
So I'll take the first one and let Lindsay take the second one. I would say that certainly the stricter regulations that we have put on sizes of different gatherings has and certainly helped us. I think that being out of the holiday season and beyond that, where we have lots of large gatherings and celebrations with families and individuals, is also helping us at this point in time. And I feel certain that the vaccine is probably helping in some ways, and we may be able to tease parts of that out by looking at our long-term care facilities and seeing what numbers of infections and other severe illness has done there in our long-term care facilities. But again, we know the level of infection in our long-term care facilities often is reflective of what their community spread is within their community. So as you say, there are multiple factors, Sherry, that contribute to this, and it may be hard to really tease out which one factor is contributing and to what percentage. Lindsay?
Yeah, so to address your question about people who are booked out really far, so we're working to identify those people. So in truth, we really only have our schedule booked out for first appointments for, the next several weeks. And then of course, there's appointments available for people to get in and make sure that their second dose is scheduled there, because we only know what we're going to get with our vaccine week to week. So we only want to project out so far. So because of some scheduling glitches, there may be some people that have got their, think they have an appointment at a later date. So we're working to identify those people and actually reach out to them, that as we add more appointments that we can move them forward. Additionally, I do encourage people that if you are several weeks out, to continue to check back at the rshot.in.gov or calling 211, because we're going to keep on opening appointments when and where we can, so that you can move your appointment earlier. And then of course we'll make sure that that other appointment is canceled.
I just wanted to also say, Sherry, just to elaborate a bit on what Dr. Box shared is, also credit where credit's due. A lot of this is personal responsibility. Hopefully with some of these, as you mentioned, restrictions, a lot of this is, your personal practices. And if people see that it is working, we are getting closer and closer, not just, because of the vaccine, but for a whole number of reasons. And so the last thing we want to do is act prematurely. When something's working, when it's moving in the right direction, we need to do more of that, not less of that. And I think what you're seeing, and you're seeing evidence of this in the business community as well, more and more businesses are figuring out ways to operate safely. And that gives not only employees higher confidence, but it also gives consumers more confidence. And when you look at the numbers that we're tracking as well, and we'll get some updates on this next week about our employment numbers, and we'll see, but we're trending and tracking in the right direction there. And that's because people are making the right decisions as well. And so, yeah, we're looking at these maps, and there's a number of reasons, and you don't want to say this is, the only reason why we're improving, because there's a whole host of things. including what we know are events that spread. And so more of it, not less of it.
Kathy from Ferdinand News.
Good afternoon, Kathy.
Good afternoon. I think I'm unmuted there.
You are.
Can you hear me?
Yes, ma'am.
I have a couple of questions. As always, I probably have 10, but I'll ask by top two. And the one is probably for Dr. Weaver. I had been told by a couple nurses, my husband got his shot last week, yay rah, his first shot, and the nurses had said an hour before, taking a leave. And when he gets his second shot, an hour before, take a leave or Tylenol or whatever, and a Benadryl. Then there was an article in the AARP magazine that said don't take any kind of, that affects how you react to the dose, so take a leave afterwards. And I'm just wanting to clarify that.
Yep.
Make sure bad advice isn't going out.
Mm-hmm.
So there's not great evidence to say that it will affect you if you just take it an hour afterwards. We do believe taking Tylenol or ibuprofen, or I'm sorry, an hour beforehand, taking Tylenol or ibuprofen, if you are having a sore arm, other symptoms, if you do get one of those low-grade fevers, et cetera, is completely appropriate and fine, and you are still getting the appropriate immune response with the vaccine.
So that isn't a problem at all. But my other question is, early on, they were saying that A blood types were more seriously affected, and I have not seen any update on that in a matter of months, and I wondered if that's still being researched and if there's anything out there.
I have not seen that either. Lindsay, do you have any more insight? I've had several people ask me that, but I literally have not seen anything from the CDC or in the literature that we often review with this.
Excuse me.
She had 10 questions, but some of them, she might have been questioning herself. I do every day.
Lindsay or Doty, the
Lindsay.
Indianapolis Business Journal.
Hi, Lindsay. Thanks for joining us.
Hi, Governor. A couple of questions. First for Dr. Weaver. It sounds like the state has been able to adjust with this issue with the national stockpile of those second doses, but just wanted to confirm, has the state canceled any appointments to date? And Governor, could you explain a little bit more about why you decided to shut down the state government buildings and the legislature this week when, we didn't see any protesters, no violence, nothing like that. So what were you told in your conversations with state police that made you worried enough to take that step?
Sure. Lindsay, you want to go first and give your 3 rules?
So my team knows my number 1 rule is do not cancel appointments. Number 2 is manage the schedule and our inventory so that doesn't happen. And number 3 is to do everything we can to help manage expectations because we know that Hoosiers really want these shots and we really want to give it to them. So in the very, very beginning, when we were expecting that large shipment of doses that second week, I don't know if people even recall that, we did have to reschedule some people into later time slots. But since then, to my knowledge, we have not canceled appointments because of lack of vaccine, and we will work as hard as we can to continue to do so. We want people to be confident that when they make their appointment, when they show up, that they're going to get a vaccine in their arm.
Yeah, and as to your second question, Lindsay, first, a couple things on a more broader scope. First of all, state government remained open all over the state of Indiana. Most business that Hoosiers conduct with their state government is out in a county or your city or town, and that remained open. We were open for business. Secondly, and I'm pleased about this, is, and I've shared this, I met with the President Pro Tem and the Speaker of the House yesterday. And so business has been continuing even on the legislative front, and they have said that they're still on track or, holding the calendar as before. Our concerns were shared with them and anyone that would come into this building. My, first priority is to make sure that we're in not just us, the people that work for the state, but the folks that are doing business with the state, are in a safe environment. And this was a week like I can't remember another, at least in my lifetime. And we were, and I will always err on the side of caution, and always be safe, not sorry. And knowing that there were, and I'll let Superintendent Carter follow up on this, but knowing that there were statements about all 50 state capitals on Wednesday and on Sunday, and knowing what had occurred at just days before that, we weren't going to chance it, and I won't chance it in the future. And so I'm pleased, quite frankly, not defensive about this at all. I am pleased that here in the state of Indiana and a lot of other states didn't have some of the issues that they were told were going to happen. And so knowing, and I'm also doubly pleased that we haven't lost any progress in terms of the legislative calendar in this 4-month period. Superintendent Carter, you want to follow up or add to or clean up anything that I've said? I hope I didn't mischaracterize any of the intel that we got.
No, there's certainly not, Governor, there's nothing to clean up. Lindsay, I wish we could anticipate human behavior. That would give us a really clear picture of what the future might look like. But I don't think anybody expects us to be able to do that. So we work tirelessly behind the scenes, and there's some things I know that I can't say, that I can't talk about. But there's 3 issues that really guided my decision and my recommendation. And I worry about these things every minute of every single day. But we had an event in Nashville, Tennessee on Christmas morning that has had a profound effect on people that look like me and dress like me, not only here in Indiana but around the country. Second was the really, really unfortunate events that occurred on January the 6th at our nation's capital. And then thirdly, one of the most likely divisive transfers of power in our history, in our country's history. So with those 3 things, and based upon what we had heard and what we have learned, I agree completely with the governor. We would much rather err on the side of caution and be as least disruptive as we could. And we accomplished that. We didn't fortify our buildings, and that was never our intent, and that I can't imagine a scenario by which we would have to do that. But the assets were here, the availability was here, the coordination was here with the IMPD and other police agencies, and to include our federal partners around the country to properly respond to an event that might have occurred here. So the good news is it didn't. I'm sure your question would be very different had we had another increase in violence or destruction of property like we did last year. So I hope that helps.
Rob with the Wabash Plain Dealer.
Afternoon, Rob.
Rob, you should be able to speak.
Oh, yep. My computer's just very old. Hello. Good to be with you this afternoon. Governor, congratulations on your 2nd term.
Thank you.
I had a question for the doctors. Dr. Box, thank you for the update regarding the mutations. Could you speak a little more about the testing protocols? Is it a separate test for the associated protein? Do you have the equipment necessary on top of the other testing equipment you already are using? What percentage of all the tests are you checking for this in, and will there be a separate dashboard for any of the mutations?
We have not thought about a dashboard for the mutations. We do have 4 known UK mutation, the B117, as I mentioned here in the state. I will say that the CDC is routinely doing surveillance. So they randomly at first were taking 10 tests from the state of Indiana. We've doubled that amount of tests now. And we also have the ability to send to a separate part of the CDC further tests from our lab to have those looked at for the mutation. We also interestingly enough, this particular variant has a change that we can pick up in some of our testing that we use to actually test to see if someone has COVID. And when we see that particular change in those tests on these 2 particular machines, that will indicate to us that it has a higher likelihood of being this mutation or a different mutation. And so we can selectively send those off. There are a couple of sites here in the state of Indiana that are doing that also. So we do definitely have access to get that test testing done, but trying to be more selective based on individuals' travel history, based on whether these tests fall out, based on the way the tests are done on TACPath and another machine.
Kayla with WXIN.
Afternoon, Kayla.
Good afternoon. I have two questions, one for the governor and one for Dr. Weaver. I'll start with Dr. Weaver. I'm curious why you said we just learned there is no national stockpile of the vaccine. Did we think there was one, or were we told there was one, and then we learned differently? Who would we hold accountable for that?
Yeah, so we had heard communications early last week that there may be additional vaccines that could be released to the states. For example, second doses that had been held back that they could then push forward, only to find out at the end of last week that that was not the case and that we had been receiving any available doses to come to us. So thankfully, we had started to make plans to ramp up, but hadn't put any of those things into place quite yet. So we just adjusted back to what our original plan was based on what we were expecting, which is that close to 80,000 doses a week.
And then, can you still hear me?
Yes.
Excellent. So for the governor, why is a more than $2 billion surplus necessary? What is the minimum amount of reserves needed to maintain our AAA rating? And could we use some of the surplus to fund public programs like unemployment, food and rental assistance, or even small business aid during this time?
Well, it depends on who you ask. There are credit raters. Chris Johnson is here, I see, but I will tell you this. Some would say 11, some would say 11.5%, some would say closer to 12, some would say 12.5%. What we want to do is, yes, maintain our AAA credit rating. It has a lot to do with locals being able to borrow and at the rates they're able to borrow at as well. Two, when you dip into a surplus, you're trying to address things that need immediate attention. And that's exactly what we used our surplus for in the first place. When this whole pandemic was really getting a grip on us all in terms of delaying our taxes that were due, helped us. I'm pleased that our economy is bouncing back and we are replenishing. We are seeing the levels at which they are. But keep in mind that when you start to use reserve dollars, and maybe most importantly, if you're going to use them, typically folks expect that to be sustained. And a reserve balance or a surplus on an annual basis is different than what's legislatively or the federal, our federal partners, the government with the CARES Act, et cetera, and the trillions of dollars that have been put into the system for child care, for utility assistance, for rent assistance, for housing assistance. And so when you look at, and Chris, you might speak to this, when you look at, pick one of those, housing assistance, we're looking at another $370 million to help people that need the help. And as you continue to see people go back to work and our economy coming back and our revenues going up, Kayla, we need to do exactly what you're saying, is help the people that need helped. And we do have the resources. Many times it's connecting them with those resources. Chris, you want to add on to any of that?
Well, I think you captured the issue very well, and that is the level of reserves is intended to cover the state in delivering critical services to our citizens when there is a shock to the economic system. And obviously, that shock did occur in 2020. And as an example, if we maintained lower reserves, and part of that shock was also the deferral of income taxes from April to July, which really significantly lowered those reserves. If we had been maintaining less reserves at that time, our reserves and our cash would have been at really low levels and probably would have impacted our ability to deliver the services. But with sufficient reserves, we were able to continue to deliver services to Hoosiers. And the other point that the governor raised is very important, I think, as well, and that is using the reserves for one-time uses for those shocks, because if you create the expectation that this would continue at those funding levels, we just have to be able to deliver services at the levels that our budget and revenue forecasts will permit.
As far as the additional uses for assistance to needy Hoosiers, at the end of December, the federal government passed a legislative package of additional assistance. One of those is rent assistance, and over $400 million will be coming to the state of Indiana, about 370 of it to the state government, and there will be 5 county governments and 1 city government that has applied for that assistance directly to deliver it to the citizens in their counties and city. And so it's a combination of both using our own state resources judiciously and to get over these economic shocks, but then also using the federal assistance judiciously in order to target it for the citizens that need it most.
Yeah, use it for what it was intended for.
Jody with WRBI.
Afternoon, Jody.
Good afternoon, Governor. My question is, I've had a growing number of citizens in the area who have family members in long-term care facilities who have their loved ones have not received the vaccine yet. And their concern is that no one can give them a timeline of when their loved ones will be able to receive that vaccine. And the solution has been presented to them that they should, if they want their loved one to get a vaccine, they take them out of the nursing home, take them to the sites, get them a vaccine, but they have to be quarantined for 2 weeks. Is there any way to find out a timeline on when the rest of you said 1/3 of the facilities still have left to be vaccinated?
I think that's a great question, and I think that they might want to ask back, because we, in our weekly calls with our federal partners and CVS and Walgreens, have asked specifically for them to give us that every single skilled nursing facility and assisted living facility has been scheduled that they have. And there's just a handful now that they're still working to get scheduled. But I do have down that CVS will complete by this weekend all of their skilled nursing facilities. So on the 23rd, with their first dose, and all of the assisted living facilities by February 15th. And Walgreens, all of their facilities, their skilled nursing facilities and assisted livings, will be completed by February the 11th. So just a handful there that are not scheduled. I think that that, again, is just the first doses. They'll be coming back for the second dose, and then even coming back a third time to clean up anybody that, may have needed to get that second dose and didn't get their first dose the first time through. So we are working very, very closely with them. I think those individuals that are more mobile, that may be living in assisted living facilities, that have family members that do want to take them to a site and get that done sooner than their facility is scheduled, certainly have that option, and we would welcome them at the sites. But we do feel like within the next 3 weeks, we will have been through with first doses to all these sites.
Amazing. Lindsay, anything to add to that? Nope.
No, other than just to say that's 1,000 places across Indiana that they will have been to in this short amount of time. So we're happy with their progress, and we'll be, like she said, we'll be there through here in the next couple of weeks.
Rich with WTHR.
Good afternoon, Rich.
Good afternoon. In a couple of weeks, we start playing March Madness in Indianapolis and Indiana. How closely is the State Board of Health working with the NCAA, Marion County Health Department, other health departments, and what type of restrictions, what type of precautions are going to be in place to keep the teams, the fans, and workers all safe? You can take more than 30 seconds if you need it.
Well, yeah, Dr. Box, you're more than just a basketball fan. It's now the job.
I'm volunteering, actually.
Yeah, exactly. You want to give an update to Rich and to anyone that's watching?
So I think it's an excellent question, and I know that Dr. Weaver and I talk to Dr. Kane almost on a daily basis with the Marion County Public Health Department, and part of that is a little premature, because it will depend a little bit on where our numbers are, what our community spread looks like at that point in time. Of course, we are on the right track right now, but in the back of our mind is that variant of the virus that we know is much more transmissible. So that may impact for instance, the number of spectators that are able to come. I do know that the NCAA has partnered with IU Health to be able to do some testing around this time. So they definitely are a great partner in that going forward. So yes, we are all working together, and very, very happy to welcome the NCAA here to the state of Indiana.
And don't forget, Rich, I mean, we've got Division I and II in Evansville and Fort Wayne. So I-69 truly is the Hoosier Hoops Highway.
Tom Davies, The Associated Press.
Afternoon, Tom.
Hello, Governor. What changes could you be making to the executive order since you've tied restrictions to the county risk ratings? Why would you roll those back? And what do you think of the national precautions being ordered by President Biden?
Yeah, you want to talk about what we look at on a weekly basis?
So
or daily?
We will continue to look at the numbers. We will continue to look at contact tracing and our percent positivity, our number of cases per 100,000 in each of our communities, and try to make decisions based on that data and that evidence. We are hoping that we continue to see a decrease in the number of hospitalizations, not only per day, but ongoing, and to see our hospitals get a little bit of a breather. Right now, more of our cases are in the younger age group, and the numbers have fallen in the older age group. But we do know that sometimes that turns around and then translates into increased cases in our elderly or older age groups, which may very well impact our hospitalizations at that time. So all of that will be a factor as we look at can we change things with regards to numbers of individuals that can be at sporting events or different events in the school systems and other places. Can we change things like the size of a gathering across the state?
Yeah, and I would just say, Tom, related to your other question, we have started to, in fact, at the time the president was being sworn in, our team was on the phone with his team, working through not just the executive orders that he signed regarding COVID-19, and which were broad and had to do with everything from FEMA reimbursement to PPE, et cetera. And we'll continue to work with the administration. I would say that in terms of, and what I'll continue to share, and probably 49 other governors and of other states, and plus the territories will continue to share, as we need more. And that I may sound like a toddler, but we need more. And so we don't want to rob Peter to pay Paul, or shift or redeploy our level. Because we have built out a system here in the state of Indiana that's in every county, multiple locations, and it's working. And that's why I said very early on, you want to use us as Exhibit A of what is working. And so we'll continue to collaborate and work with our federal partners, as we always have, not just looking back into the past, but well into the future. And anything that can help us get more shots in arms, be it in Indiana or anywhere else around the country, we want to be a partner in that.
And almost every one of those sites that Lindsay talked about and you're referring to has the ability to dramatically increase the number of vaccines that they could do each day if they just had the supply. So we're just waiting on the vaccine, as you say.
We want to be a full partner in this.
Dan from Wish TV.
Afternoon, Dan.
Good afternoon, Governor. Thanks for talking with us today. I kind of wanted to go back a little bit to Sherry's question earlier, as she was talking about the factors for the decrease. That was one of the things I was most interested in as well. As you were responding to that, it sort of seemed like you were responding in generalities of, smaller crowds, things like that. But is there anything you can say with certainty about the top 2 or 3 factors, reason for the decrease in positivity rate? And then my other question is, do you anticipate seeing any changes coming with a new president in office, as of yesterday? What changes do you anticipate seeing in the future?
Well, let me answer the second one first, because it'll be quick. Elections have consequences. There will be changes. That's understandable. And we'll look forward to working with anyone and everyone, including this administration, that's going to help us make Indiana stronger. And the first things first, and it's dealing with COVID-19 and its ravaging effects that it's had on us and every other state for that matter. And so we'll continue. Like I said, as the president was being sworn in, we were on the phone with their team, and we'll keep those relationships up and up and running, putting Hoosiers first. Again, we talk in generalities, maybe because you can't pinpoint or assign a percentage to this is what's working. Anecdotally, I can tell you that more and more people are presenting the evidence with me about how they're safely conducting their business, or how they're practicing, washing hands and watching their distances and wearing a mask and not having those big super spreader events. Or more people locally are getting involved, saying we got to get through this sooner, not later. We don't want to drag this on. We don't want to be a laggard. We want to help get us through this. And now all of a sudden, the thing that's different in this whole equation is there is light at the tunnel that we can see, and there is a vaccine there. And it's changed the discussion is, how do we get there? How do we get to the light? We've always hoped for it. Now we see it. And so that's on us, every single one of us. And so, yeah, we want to celebrate the best practices, and we want to celebrate the numbers going down. Still have a long way. We'd like to be closer to 5% spread. We're double that. And so, yes, we're managing our way through this better than ever, I think, and seeing evidence of that. But that's got to do with our vigilance and the vaccine and the therapeutics. And it's a whole host of very specific things, but you can't maybe...
I think it's very hard to sort out what percentage it is. I do think that there's no question that some of the restrictions we've placed have really helped. I think getting through the holiday season has been a huge help, because there are just so many gatherings that occurred during that time, despite the and travel, despite recommendations for us to not, get together with families outside of our own nuclear family. So I think that's a big part of it. I'd like to believe that the vaccine is already starting to impact this, but again, it is hard to say. But I do think Hoosiers see this on the horizon, that, as the governor says, there's a light at the end of the tunnel, and how do we get there, and how do we get there safely, and how do we save the most lives as we get to that point?
Yeah, best practices, and then my 4 words: faster immunization, slower spread. So those 2 things, your personal decisions that you're making out there, personal responsibility and decisions, and then what we're all doing together, and that is making sure we're trying to increase the speed of immunizations.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be Wednesday at 2:30 p.m. Eastern.